All right, hello and welcome. Today, we're going to dive deep into a really common but pretty misunderstood shoulder injury, the slap lesion. We're going to break down what it is, why it happens, and what that road to recovery really looks like. So let's get right into it.
You know that feeling? You reach up for something on a high shelf, maybe you throw a ball, and suddenly you feel this weird pop, or a deep clicking sensation, or just this nagging ache inside your shoulder. It is so frustrating, and it really makes you wonder, what in the world is going on in there?
I mean, your shoulder joint is truly an incredible piece of engineering. It's got the biggest range of motion of any joint in your entire body. But, well, that freedom comes with the trade-off. Unlike a super stable joint like your knee, your shoulder is kind of like a golf ball sitting on a tee. It's naturally a little wobbly and has to rely on a whole team of other tissues to keep it stable.
So how do we keep that golf ball from just falling right off the tee? Well, the shoulder has some really clever tricks up its sleeve, and one of the absolute most important pieces of the puzzle is this sort of secret stabilizer called the labrum. So the labrum is this ring of soft, flexible cartilage that goes all the way around the edge of your shoulder socket. The best way to think about it is like a rubber gasket or maybe a suction cup. Its main job is to make that shallow socket deeper, which gives it way more stability. We're talking about expanding the contact area by up to 75%. It's this crucial shock absorber that keeps everything secure. And right here, at the very top of the labrum, you can think of it as the 12 o'clock position. Something incredibly important attaches, the long head of your biceps tendon. Now this connection point, this is the key. It acts just like a ship's anchor, holding that biceps tendon firmly to the bone. This anchor is absolutely central to what we're talking about today. So you can probably guess what happens next. When that anchor gets damaged, it causes a very specific kind of injury, and that is what we call a slap lesion. It often happens because of something called a peel-back mechanism. So what on earth is a slap lesion? Well, the acronym SLAP stands for Superior Labrum Anterior to Posterior. It sounds complex, but all it really means is a tear at the top part, the superior part, of the labrum, and that tear runs from the front to the back. In simple terms, the biceps anchor literally peels away from the bone, almost like a sticker that's lost its grip. That peeling action sounds pretty intense, right? So you've got to wonder, what kind of force is powerful enough to pull that big biceps anchor right off the bone? Well, it usually happens during these really powerful overhead movements. Just picture a baseball pitcher right at that moment when their arm is all the way up and rotated as far back as it can go. That specific position creates this massive twisting force, a torsional force, right on that biceps anchor. If that force is too strong, or it just happens over and over and over again, it can actually peel the top of the labrum right off the socket. But here's the thing, not all SLAP lesions are the same. Like with most injuries, there's a whole spectrum, from pretty mild to really severe. And so doctors classify them into different types, and that's what helps them figure out the absolute best way to treat it.
Let's just look at the two most common types to see what I mean. Over here on the left, a type 1 tear is kind of like the frayed end of a rope. The labrum is a little worn, a little fuzzy, but the anchor itself is still solidly attached. Now on the right, that's a type 2 tear, and this is the most common one that needs surgery. In this case, the anchor has actually pulled away and detached from the bone. That's a big difference, and that's what creates that feeling of instability.
Then you have more serious injuries, like a type 3 or a type 4. These get a little more complicated. They can involve what's called a bucket handle tear, which is where a piece of the labrum actually tears and flips down into the joint, kind of like, well, the handle of a bucket. Sometimes these can even involve the biceps tendon itself.
Okay, so now that we get the what, let's talk about the why, and maybe more importantly, how it feels. What are the common ways this injury happens, and what are the symptoms that you should really be looking out for?
So, what brings this on? It can be a one-time thing, like a bad fall onto your outstretched arm, or it can build up over time from all that repetitive stress in overhead sports. Think baseball, tennis, volleyball. The symptoms, they're usually pretty distinct. A lot of people talk about that popping or clicking, that deep, nagging ache inside the shoulder, or just this general feeling that the shoulder isn't quite stable. and this almost always leads to a drop in strength. Sometimes athletes even describe it as a dead arm feeling.
Okay, so if any of this is sounding a little too familiar, you're probably wondering, what's next? So let's walk through the path to getting a diagnosis and starting that recovery. It's a pretty clear and structured process, which is the good news. Your doctor is going to start just by listening to your story, what you're feeling, how it happened. Then comes the physical exam. They'll use these very specific movements to put a little tension on that biceps anchor to see if it triggers the pain you've been feeling. Finally, to really confirm what's going on, they'll usually order an MRI, sometimes with a special dye, to get a super detailed, high-resolution picture of the labrum and see for sure if that anchor has been pulled away. Now, this is one of the most important things to remember. There is no one-size-fits-all treatment. The right plan for you is always going to be tailored specifically to you. It really depends on the type of tear you have, your age, how active you are, and what your goals are. We can actually boil the treatment options down into 3 main goals. First, if the labrum is just frayed, remember that type 1 tear, the goal is to simply clean up the damaged tissue. If that anchor is detached but the tissue is still healthy, especially in a younger person, the goal is to repair it. They'll reattach it to the bone using tiny little suture anchors. And finally, if the anchor itself is really beat up, often in an older patient, the goal might be to just reroute the biceps tendon, moving where it attaches to get rid of that painful pulling force altogether. But no matter which path is chosen, here's the deal. Recovery is a team effort. It is a true partnership between you, your surgeon, and your physical therapist. Your commitment to doing the rehab work is every bit as important as the surgery itself. And that really brings us to the most crucial point of all. Everything we've just talked about, it all comes down to one thing: getting an accurate diagnosis. Really understanding exactly what is wrong with that biceps anchor is the absolute foundation for getting effective treatment and getting you back to doing what you love. So if you are feeling that clicking, that popping, that deep ache inside your shoulder, what is the single most important next step you can take? It's getting a professional evaluation to find out for sure if your anchor is secure. Because at the end of the day, a stable anchor is the key to a strong, healthy, and happy shoulder. Thanks for joining us.